Okay, everybody, I'm so sorry. I was tutoring and then I forgot to record it. So now I'm gonna record it again and I'm gonna put it on the YouTube, okay? So this is the quiz and number two, and we have a 20 question here. So not just see the number one question. Influencing the factor of the surgery. So here's some kind of like a factor will change the surgery and change the patient their healing. So either way, the age and age is young or age is old, very little child or very old senior. So it's kind of like a factor and any kind of disease. For example, like a COPD, so like a malnutrition or either way diabetes. These kind of things also will change the healing factor. Nutrition, how is the nutrition status? Can patient eat? And the physical strength. So the patient, can they walk and do they have very good physical status? And also substance abuse. That means maybe patient is drinking a lot of alcohol. So also affect to the patient healing. So one of the factor is in the question or in the answer. So you're gonna see it. So just pick that one. So all the answer is here in the hint. So you just pick one. Number two, the elderly post-surgery recovered not well. So this patient is a senior patient and is become like a restless and also confused right now. So it's not recovering very well. So what would you do? What would you do for this patient? So would you do something or would you just assess the patient and would you just give patient something? Think about something. After the surgery, immediately, so why patient is confused and restless? It could be like anesthesia. It could be like a blood loss. It could be like a hypoxia. Okay, so many things is going to be happen. So when you assess and then you find out patient is there something wrong and can you provide the patient something? So that will be the answer. Okay, the answer is asking you after you done something and can you do something. Number three, so religion people and post-surgery recover and does not want to participate with the activity. So this question is asking, this patient have like a special religion. So after the surgery, the patient doesn't want to get up to walk. The patient want to do something, okay, for his religion. So what would you do? Do you just let the patient refuse? Well, actually can't. We know. Because the patient after surgery, they really need to get out to ambulate. So ambulation is have lots of good benefit. Okay, also prevent lots of complication like a DVT or pneumonia and lung clot and either way like a constipation and a pressure ulcer. So this is the reason we still have to the patient participate with the ambulation. But the patient, the religion, we also need to respect them, right? So that's why. So the better answer, the better way we're doing is they say, okay, I will respect your religion, I will let you do it. But after that, I will come back later. So after that, so I hope you just finish your routine and we need to get you up out of bed and you still need to ambulate because we don't want you to have any kind of complication after surgery. So this is the way we deal with the patient, okay? Some kind of like a medical intervention is very important. We don't want a patient just get some kind of injury. That's why we really need to kind of like have a patient participate with the activity. Number four, inform consent and explain the procedure. Okay, so do you think you can explain the procedure? I don't think so, right? So usually we cannot explain the procedure, but when we just give an informed consent to the patient and the patient just suddenly have a question, say, I do not understand the procedure very well. So what would you do? So what would you do if a patient they want to sign informed consent, but they suddenly just tell you, I don't understand the procedure? Oh, excuse me. Okay, number five. So holding the medication before the surgery. So there are some medication we need to hold before the surgery. Oh, excuse me. For the safety issue. So, what kind of surgery usually we hold before the surgery? So, don't overthink about this question. This question answer is very, very easy. Just think about what medication usually we hold, and I mentioned it in the class already. Sixth, so before the surgery, a normal diagnosis lab. So that means before the surgery, we need to just get some kind of diagnosis exam, right? Either we draw the blood or urine analysis, maybe EKG, or maybe chest X-ray, or maybe some like a CT scan or MRI. So Here's the problem is, so one of the diagnosis or the lab is showing like abnormal value. So in that kind of case, so can you identify and what would you do? Do you think you still want to proceed the surgery, or you want to or you want to call the provider and notify the provider? Okay, that will be your nursing judgment. Okay. Number 7. Nursing intervention for the GLP-1 medication before the surgery. So what will happen to GLP-1 medication for the surgery? So they will delay empty the stomach, right? So that means if a patient taking the GLP-1 medication, the NPO should be like over 12 hours, not just only 8 hours. So we want to make sure that the stomach is all empty and the GI system is all empty. But here is a problem. GLP-1 medication, remember I usually just told you we usually come with a one box, have a 4 needle. So every week we have a 1 needle. So patient just need to inject once a week. So this patient is tell you, okay, I actually injected GLP-1 medication a couple days ago. So what should I do for the surgery? Okay, so that's why you need to do something. You need to check if you need to check something related to the GLP-1 medication. That's why you can make sure if a patient can go into the surgery or not. Okay, just check some kind of like a system, like some system like for example like a cardiovascular system or pulmonary system or like a kidney system or like a GI system or like a endocrine system. So what kind of system you should check before the surgery? Number 8, latest allergy for the surgery prevention. So if the patient have like an allergy to the latex, so what would you do? So usually when we just have this kind of allergy, so that's a patient will have allergy band on the hand, right? The wristband. But besides all that, what would you do? Can you just notify somebody and who you are going to notify? Okay, so for the equipment, what would you do? Can you just tape all the equipment or just have like an air filter and filter out with all the latest powder? Yes or no? So that will be your nursing judgment. Okay, just be careful. The patient have allergy and you need to file a report. Okay, let somebody know before the surgery. Number 9, incentive spirometer using method. So remember the PowerPoint, we have 2 PowerPoint talking about incentive spirometer. So that will be the 2 PowerPoint. So as this question is asking you how the patient can just use the incentive spirometer. So can the patient hold the breathing? How many seconds? So the patient, the mouth need to seal the peak? Yes or no? All right. So how many cycle per hour? Okay, how many cycle per hour? And is the patient need to empty the lung before they inhale the incentive spirometer? So after that, the patient need to blow out. How can they blow out? Okay, all this kind of using method is going to be in a 4 answer, but one of the answer is correct. So that's why you need to pick the correct answer. Okay. Number 10, DVT prevention, the best way. So what is the best way to prevent the DVT? So remember we have like a number 1, 2, 3, right? So the number 1 is early ambulation, and number 2 is a STD machine, and number 3, if unfortunately this 2 is not available, we have to use a medication, right, like anticoagulant. But this question does not have this 3 answer. So if we don't have these 3 answers, the patient still lying in the bed, they cannot get up. Then maybe it's too weak or maybe have lots of pain. So in the bed, so what would you do to prevent their DVT? Can you do something for them to prevent their DVT? Yes or no? Okay. Number 11. The main reason for splinting the pillow when we coughing. So after the surgery, we want a patient to have like a coughing exercise, right? So cough up with a fan or either way just open the lung. But what's the reason we want to spring the pillow? Okay, there's 2 reasons most likely. The number 1 reason actually is holding the pillow and with the pressure will decrease the pain. That one is the majority reason. And the number 2 reason is because we want to prevent if a surgical site will be pop out. Okay, so this 2 reason, but the majority one is decreasing the pain. 12. The patient refused early ambulation after the surgery and your intervention. So this is also another patient refuse your participate again. So what would you do? So can you just check why patient is refusing the ambulation? Because ambulation really have lots of good benefit. We want to do it, right? So if a patient just tell you some kind of reason, can you fix the problem? Can you fix that problem and then you still can have a patient ambulation? For example, patient tell you I have a dizziness, so can you do something? Patient tell you, okay, I need to pee. Can you do something? Okay, patient tell you, okay, I feel so tired. Can you do something? Yeah, and the patient tell you I have lots of pain. Can you do something? And then you still can ambulate the patient. Yes or no? 13. The post-surgery, the patient wants to eat and drink right away and your intervention. Do you think the patient after the surgery, they can eat and drink right away, just immediately? Usually it's not, right? Because it's kind of like a aspiration precaution because we don't know if a patient they can eat or drink yet. Maybe they will choke. So that's why usually from the beginning we start with a clear liquid diet and sip with some kind of water or ice chip, right? But besides all that, can you check something before patient to eat? So remember, check something before they eat. Check something very important. If they do have that activity, then the patient can eat a normal food. But if the patient does not have that kind of activity, after you check it, so that means the patient still cannot eat. So what is the things you need to check after the surgery? Think about it. Okay. So 14, the post-surgery intake and output, so the value level. So this question is asking, okay, so after the surgery and some intake and output, the number is changed, okay. So what kind of the value level is kind of like a correct or is normal or abnormal? So here is some kind of like a hint. So do you think the urine output, how much it should be normal? So that's why you can see the decreasing and increasing. So that's why we'll know, okay, this is normal or abnormal. And the blood loss. So how much blood loss is normal? Okay, is that saturated with a whole dressing or lost the blood over like a couple hundred cc per hour? How about the vomiting? Usually after the anesthesia and also pain medication, patient will feel nausea, vomiting. This is normal. So if the patient just in the recovery room, so it's vomiting one time or two times, and maybe just like a 100, 200 cc, we should not concern. That's fine. But if it's vomiting a lot, the patient is vomiting like over 500 cc, or either way, patient actually is vomiting a couple times already. Is that trigger your concern? How about IV hydration? So we know the patient need to have IV hydration after the surgery because we want to flush out with some kind of like anesthesia, right? But here's the problem. So the heart and the kidney is not fully awake yet. So do you think we can overhydrate the patient? Even these two organ is not re-function after the surgery yet? Under anesthesia. How about if it's too low? So patient is being like NPO so long before the surgery, and your hydration is not enough. So what will happen? So that's why remember this question is asking you. So the intake and output, which one you need concern? Okay. 15. The patient control analgesia, that means the PCA pump, the patient education. So remember, we also have a PowerPoint for this, okay? So the PCA pump, so what is the education for the patient? What we tell the patient. So the PCA pump, the patient can control by their pain. Do you feel like the patient need to have a severe pain? That's why they can push the PCA pump. Or either way, they have some pain, we just push before, and we can prevent the pain. Okay. So when the patient is sleeping, do you think the family and the nurse can push the pump for them? Yes or no? So do you think the pump should be locked or not? Okay, inside is a control medication. Do you think we need to lock it or not? Our family member will mess it up, right? Okay, and what else the PCA pump analogy you think is kind of important for the patient they need to know? Okay, that will be your education. Okay, 16. Without checklist, day of the surgery. So all the items, which one is more priority? That means which one is very, very important. So all this kind of like answer is here. So one of the answer is the correct answer in this question. So do you think which one is missing? And for sure, you need to delay the surgery. Okay, if something is missing here, for sure, you need to delay the surgery. You cannot have the surgery right away. So what is that? All the answer is inside here. Just pick one you're thinking about most so likely is possible. Be the answer. All right, 17. The doctor have some order for the post-surgery patient. So which order is questionable? That means the doctor actually is missing some order. Okay, so that order is missing, and then you need to call the doctor and just tell the doctor, hey, I need this order because you did not provide this order for me, and I feel like this is danger. Okay, so which one, which patient is going to be in danger? So the IV order, and do you think IV order is very important? The pain medication order is very important. Intake and output order is very important. Our blood pressure medication order is also very important for this patient. So when you see the answer and you will understand, okay, there's four answer here. So one is kind of like a patient in a danger zone. So that's why remember pick that answer, okay? 18. So this patient is having a baby, is laboring the baby. So and she have epidural anesthesia, and that's why she can have anesthesia and not having a pain to deliver the baby. But here is a problem. So after we give epidural anesthesia, it have some kind of danger sign. So which one you feel like is also danger? Is the BP high and BP low is a danger? And the fetal heart rate increasing and decreasing, this is a danger. So how about the CHF fluid is leakage? Do you think this is a danger? The patient tell you she have headache. Do you think this is danger? And the bladder distension. How about if this is danger? And also lower extremity motor and sensitive blood. That means the patient cannot feel anything below like a lower part of the body. Do you think this is danger? So which one? So this four answer is asking you one of the answer actually is very, very dangerous. So that's why we need to call that right away. Maybe we need to adjust about like anesthesia dosage. 19. Evisceration nursing intervention. That means the organ is popped out from the surgical side. So what would you do? This one is very, very easy. Don't overthink it. Just remember, okay, we need to cover something. We have to cover something for the organ. That's why the organ can just go to the surgery. It will be putting back to the body, okay? 20. So surgical discharge education, okay. So all the answers here, like educate the patient safety, wound care, activity restriction, medication and diet and lifestyle change, and also recognize a reflex complication like an infection or hemorrhage, okay. So when the patient going home, patient is going to tell you something, okay. This is four answer. One answer, patient is telling you, okay, I'm doing something and it's going to be good for me. The patient say something right. Okay, you need to pick the right answer. And another three answer is all wrong. Okay, the patient actually is not following the command very well. That's all wrong. Okay, so that means your teaching is effective. Just pick the right answer. Okay, so here is all the record. So I'm gonna post on the YouTube. Okay, and you can just listen again and again. And good luck.